And welcome back. If you haven't noticed, we've dedicated most of our show today to talking about health issues and getting the word out for information and awareness. We talked about Bell's palsy, talked about breast cancer, and now yet another one. Jacobi Hospital OB-GYN department is offering several services to women, such as Pap smears, mammograms, gynecological surgery, prenatal care, childbirth education, and much more. And joining us now to talk about the importance of visiting a gynecologist is Dr. Daryl Weiland, who's the interim vice chair of OB-GYN services at Jacobi Hospital. And thank you so much for being with us.
Thank you for having me.
So as we talk a little bit about this, OB-GYN care is something that many women are supposed to do. We find that sometimes some are delinquent and sometimes not even taking advantage of OB-GYN services.
Right. Well, it's really important for women to have their health care, and we recommend that they come annually. I think that certainly in the reproductive ages, like between 21 and 45, oftentimes the gynecologist or women's health services is the primary care for women. And so taking the whole gamut of all their issues, their menstrual health, their sexual health, their risk for disease like sexually transmitted infections, and family planning services, deciding when you want to have a child spacing, and if you don't want to have children at all.
Right. And so I think when sometimes people hear about the word gynecologist, it's only related to one area, right? But then it's so multifaceted.
Right. I mean, I prefer actually calling it women's health services because I really think we take care of the whole woman, and the woman is taking care of the whole family. So it's really important that she's strong and healthy for the rest of her family.
Yeah. So give us a little bit about what you provide.
We offer all services. So we have a full floor. We offer prenatal care at the level of midwifery services, which is really a very intimate relationship with the midwife, versus high-risk services for people who have complex medical problems associated with their pregnancy. And then other women and not pregnant get GYN care. So we have cervical cancer screening, as you mentioned previously, breast cancer screening as well, and screening for sexually transmitted infections, and screening for contraceptive advice.
So talk to me a little bit about what age a woman should be visiting.
Well, we do take care of teenagers, and some teenagers are in that transition between seeing a pediatrician and then becoming a woman, an adult. And so we often take care of teens who become pregnant or don't want to become pregnant. And so, but certainly at 21, that's kind of this magic age where we tend to start the cervical cancer screening program. And that continues through 65. But a woman should really be visiting I would say a GYN annually between 21 and 50, and maybe every year to other year after that. But I don't think it ever stops.
We hear these words and sometimes all of us are not familiar with them. Pelvic exam, Pap smear. So what is a pelvic exam? What's a Pap smear?
Well, so they are different, and people think that if they had a pelvic exam, they had a Pap smear.
Right.
But we don't have to do the Pap smear as frequently as we used to in the past, which is great, but it means sometimes people forget that they should go more regularly. So the Pap smear itself is some test of the cells in the cervix, and it's also testing for something called HPV, which is the human papillomavirus that can cause cervical cancer. The advantage of doing a Pap smear on a regular basis is that you can catch cervical cancer so early that you would never even get cancer, and you can treat it really quite easily without ever having to go to cervical cancer. One of the risk factors that people don't really think about for cervical cancer is actually not having had a Pap smear for more than 5 years. So if it's been more than 5 years, make sure you get in. The pelvic exam is actually when we're feeling the organ. So we're feeling the size of the uterus, the size of the ovaries. We're also evaluating for pain or tenderness and things like that. The advantage of doing that is we might find cysts on the ovaries or fibroids on the uterus, and both of those things can cause women to have symptoms and issues that might need some medical management, some surgical management.
I guess the optimal question is, how often should one come in for a visit?
I think I would say every year up until 50, about every year to 2 years after that.
And a mammogram test.
The mammogram is kind of funny. The different colleges are recommending different things. So you should definitely between 50 and 60 have a mammogram every year. After 60, and I would continue, most of my patients continue it annually after that as well. Between 40 and 50, there's some conflicts. I think that's a lot between the patient and her history and the interaction with her physician. So if between 40 and 50, it's usually 1 to 2 years. And also just kind of having some breast self-awareness and realizing, you know, is there anything wrong and is there anything different, and also knowing your family history.
Are we seeing anything, any trends coming through your office a lot? Or?
Well, one thing is something we hadn't mentioned, which is something called prolapse. So prolapse is usually a disorder of women over 50 related to having had children, going into menopause. They feel a sensation of pressure or something falling out, and sometimes also have symptoms of urgency or frequency, problems with their bladder. And so they can get checked out because there's lots of treatments for that. Some treatments are medical, some interventions, and then some surgery.
Interesting things that we got to definitely keep our women abreast. Thank you, Dr. Weiland, for coming and taking the time to share with us a little bit about this.
Thank you.
All righty, Dr. Weiland here with us in studio. Now listen, for more information, you can visit their website at nychealthandhospitals.org/Jacobi, and you can find out all the information you need there. All righty, well, we want to let you know also that we've got more shows, so stay with us. We are coming right back in a few, right after this.